you're driving on the road and bump, there comes a pothole. So, have you seen a pothole? Obviously you have. But have you observed it carefully? There is always some accumulation of water, dirt or some garbage in a pothole. And if you don't treat it in time, the pothole goes on increasing. Why am I telling you this? Hello and very happy morning to all of you. And welcome to my channel Dr. Mansi Shah and my show Monday Mornings with Mansi. So why have I been telling you this pothole story? Because it is somewhere related to today's topic. Prevention is better than cure. We all have heard that. So, can we prevent caries? Yes, we can prevent caries. How? By two methods. By application of pit and fissure sealants, and second is fluoride application. So today we will be discussing about pit and fissure sealants. We all know that our teeth anatomy is very different in every person, and it all has depressions and elevations. Why? It is because the food that we need to chew, that has to be cut down, it has to be broken down. So it has some elevations and depressions. In this elevations and depressions, there is accumulation of food. So what we do is we seal this elevations and depressions by a sealant. Make that area surface smooth. So it is very easy to clean that area by saliva or by water. Who can undergo this treatment of pit and fissure sealant application? In primary or the milk teeth, it is around 3 to 4 years of age when the back tooth have erupted. And in the permanent tooth, it is 6 years of age, and second 13 to 14 years of age. Why 6 years and 13 to 14 is your last tooth, that is the molars, or in Hindi what we call it as dad. They erupt at this age. One is 6 years and second is 13 to 14 years of age. So this tooth has mainly to be prevented by accumulation of food. Once we make that surface area smooth, accumulation of food is prevented. Now how do we do that? Do we have to really drill the tooth for application of this cement or this flowable material? No. We just have to edge the material. That is, make the surface of the teeth a little rough, so the material that we are going to cure or going to apply to the teeth, that should stay. How do we make the tooth surface rough? Is by a process called etching. So a gel is applied, it makes the teeth surface rough. Then a cement is applied. This cement is usually called as flowable cement or special pit and fissure sealants. So once the sealant is applied, it is cured by the light and it is made, the surface is made smooth. Now, does that cause, is there any elevation of the tooth or in the bite? No, not really. The sealant is applied in a very thin layer. It just makes or fills the pit and fissures. Is it a compulsory treatment that we all should apply this pit and fissure sealants? Yes, mostly with today's generation, almost 90 to 95% of children need this treatment. And secondly, whom you should not take or who can be saved from having this treatment is the ones whose pit and fissures are quite self-cleansable. There is no caries formation or accumulation of food in them. Secondly, the ones which have already got cavity. So if you have got a cavity, you need filling. This treatment of prevention then cannot really be done. So these are the two categories. And yes, there is one more third category also, which is if the tooth, like the molar, has been caries free for 4 years. Means if you go to the dentist at the age of 18 and you say that I want to have the treatment done, but the tooth has already got no cavities for 4 years from its eruption, then you don't really have to undergo this treatment. So this was the third category, and this is all about pit and fissure sealants. If you have any questions or want to undergo the treatment, do mention your name and ask your question in the comment section below. Do like, comment, share and subscribe this page, Dr. Mansi Shah. And yes, keep sharing, be safe, be happy, stay terrific.